This is Elise Wolf, Senior Analyst for Computer-Assisted Surgery for SmartTrack. I'm here at the 2019 AAOS meeting. Today I'm talking to Dr. Samuel Cho, the Chief of Spine Surgery at Mount Sinai West and Professor of Orthopedic Surgery and Neurosurgery at the Icahn School of Medicine at Mount Sinai. Thanks so much for speaking with me today, Dr. Cho.
It's my pleasure.
So for the second year in a row, robotics is a hot topic at this year's AAOS. Could you discuss some of the trends and directions for robotics in spine?
Sure. I think robotic surgery it has been introduced in 2000 with the Da Vinci system first. And in orthopedic space, it came out less than a decade ago, and it's becoming more and more prevalent in what we do. However, I think it's in the beginning stages. There's a lot of potential and moving parts. So there's a lot of excitement and a lot of things that we need to work on to make it safe and efficient for our patients.
Do you use a robotic system currently?
I currently do not use a robotic system. We are in the process of looking into one. Right now, there are several vendors that we're investigating.
Do you have any sense for which might have competitive advantages over other systems?
I think for the time being, most of the robotic systems for spine applications are trying to do the same thing, and that is to place pedicle screws accurately. Some companies are trying to go beyond that to develop systems where they can provide some retraction guidance during fusion procedures. Those are in the working process right now. So I don't have any idea as to when that's going to come to market.
Okay, great. Right now, as you mentioned, spine robotics is still very early in the adoption cycle.
Right.
Medtronic back at the NASS meeting had mentioned they're thinking that perhaps 35% of spine surgeries will be performed robotically assisted in 10 years. Do you agree with that? What do you think the adoption might be about 5 to 10 years down the road?
I think the robots are certainly going to stay with us, and the algorithms that control the robots will continue to improve. And if that is the case, and the industry as a whole can prove that robotics can provide accurate and safe implementation of pedicle screw instrumentation, then certainly it is possible that there can be a wider adoption of the technology.
And looking at navigation systems that have been around for decades
Right.
now, and if you look at robotics, there's a lot of integration of navigation with the Medtronic Mazor Stealth Edition
Right.
that's come out, and Globus Excelsius GPS. How do you see the adoption of navigation technologies moving forward? It's taken a long time to get some traction, but where do you see that going in the future?
Right. So there is an interface between stereotactic navigation and robotics. I think over the past couple of decades, the navigation technology, as you have said, had matured to the point that it is very surgeon-friendly and usable. And I think the breakthrough came with clearer images and also accurate optics of the guides, the probes that allow us to locate the pedicle accurately. So I think if you can adopt and transition that technology and know-how into robotics, that's where the navigation systems can talk and work with the robotics that are in development.
Do you think that as that integration continues, there still will be a large need for standalone navigation technologies?
I think so. In order to be utilized in the operating rooms, we need a complete system, not something that is in development. Mm-hmm. And navigation can provide such technology in the meantime.
Great, thank you. Aside from robotics and navigation, what other computer-assisted technologies that are being showcased here at AAOS are of particular interest to you?
I think some of the radiographic imaging technologies, such as the low radiation dual X-rays, are not only good for the patients, but also provide better imaging for surgeons to appreciate the bony anatomy. I think that's an exciting technology that had been out there for over a decade now. And also some of the 3D imaging technologies that had been developed are also exciting.
Mm-hmm. Have you been able to demonstrate any of the augmented reality technologies? There are quite a few that are being displayed at the meeting.
So I haven't gone down to test them out, but I will certainly do so after this interview. I think it's actually exciting that we can not only see the reality, the actual human anatomy, but also overlay them with some of the imaging that we can and safely navigate some of the dangerous organs that we don't want to disturb during surgical procedures. So I think AR can certainly add to that.
Great. So what are your biggest takeaways from the meeting this year as far as computer-assisted technology? Is it clinical studies or the technology being shown? What are your key takeaways that you're taking away from the meeting?
I think there had been incremental improvement in all of these technologies. From my perspective, it requires a few more years to make it efficient and a little bit more accurate. But I think the hype, the enthusiasm are there. In the days and years to come, I hope that we can see more of these technologies being utilized in the operating rooms.
Fantastic. And before we go, are there any other comments that you'd like to make or anything you'd like to...
So one thing that I've been excited about is artificial intelligence and machine learning. I think the mechanical components are already there, the articulations and the mechanics of the physical robots are pretty good at the moment, but there's a lot of room for growth in terms of the software side, the brain that controls the robot arms. So I'm very excited about that.
It's interesting because I sat in on that lecture this morning on the artificial intelligence, and to see not only the way it works with the robots, but also perhaps with some of the wearable technology that patients can wear with the apps that collect their health information and send them back, that there's some talk about doing some artificial intelligence with that too.
Right.
Yeah, I think
So one of the major components of the fourth industrial revolution. So we'll see where we go with that technology in healthcare.
Well, great. Well, thank you so much for your time today. I really appreciate it.
Sure. Thank you very much.